VTN Business Delite, moving business forward.
Hey guys, welcome to VTN Business Delite. My name is Priska Chemeka, your host. Please don't forget to subscribe on this channel. This week, we're bringing you another personality. He's one of the industry players. Sit back, relax yourself while we unfold the details.
For nearly a decade, World Malaria Day has provided an important focus for the global fight against the disease, which continues to kill more than 400,000 people every year. One of the world's vital annual public health campaigns, 25 April, is a chance for the malaria community to come together, shining a spotlight on the need for continued investment, research and development, and sustained political commitment to malaria prevention and eventual elimination. In the quest to put malaria's reign to an end in the third world countries, constant findings and evolving spate of technological research have been conducted. This has bettered the Oliset net. VTN Business Delite brings a brief background of Mr. Olalekan Asuni's profile. Having a wealthy background in the pharmaceutical sphere, he boasts an enviable wealth of experience with intimidating CV to show for this. He demonstrates sterling leadership qualities, high learning agility, emotional intelligence, humility, and a drive for success. He started his professional career with Gastro OTC in 1991 as a medical representative, rising to a senior medical representative. Between 1996 and 1999, he became product manager and rose to become the group product manager of the company between January 2000 and November 2004. He joined the GlaxoSmithKline Pharmaceutical Anglophone and Central Africa in November 2004 as marketing and HSA manager, while from April 2006 to June 2008, he became the marketing director, charged with the responsibility of formulating and directing the company's marketing strategy in Anglophone West and Central Africa, among other responsibilities. On July 1, 2008, he became the managing director of the company, recording achievements in the course of his career, among which are leading the team that produced the best strategy at Building Great Brand 1 and 2 workshop, led the GSK Pharmaceutical Nigeria Local Manufacturing Capacity Building Project, among others. He has attended several general management and function-specific workshops and courses locally and internationally. Currently, he steers the helm of affairs at a leading pharmaceutical brand, Lafarge. At the moment, Lafarge Pharmaceuticals have 4 major divisions, namely Pharmaceuticals, Vaccines and Biological, Medical Devices, and Public Health Department. Sit back while we bring you an insightful chat with Mr. Lekan Asuni, the MD CEO of Lafarge Company.
Lafarge Pharmaceutical, a startup pharma company, and we are poised to change the landscape in Africa. We are committed to good manufacturing practices, being ethical in the way we market and distribute our products. We want to ensure that our staff are energized, they are engaged, and they're able to aspire to the best of their career in the organization. Since we started off, we have 2 divisions in the company. We have Lafarge Pharmaceutical Operations. In that, we actually into manufacturing, distribution, and marketing of products. And our product ranges from different categories, from those that are for anti-infectives to those who are for GIT, gastrointestinal problems, as well as respiratory. That's the field we play right now in the commercial space. We're equally looking at opportunity for vaccines production and commercialization in Nigeria. On the professional side, we look at our wealth of experience and expertise we have in the industry. Having worked for over 2 decades in a multinational, we feel with the understanding of the pharma industry, there's a need to be able to allow people to tap into that. So in the professional side, professional services is our consultancy service arm, where we provide insight into dynamics in the pharma market in Nigeria. We look at the pharmaceutical value chain from start to finish, and we help to unlock barriers. We provide strategic solutions, and such solutions we take it on board if the client wants to execution. So these are the things we'll be doing the couple of months that the company has started, and I can tell you it's really fulfilling to see that we're actually living to our expectation. The vision of the company is to make people healthier, contribute our culture to making people healthier, and within the defined of confines of the business, we're actually we're working towards that. NIROFARM is the umbrella body trade association for R&D based companies, pharmaceutical companies, either locally operating or operating through agents. So we subscribe to research and development, all member companies of the association. We've been involved in quite a number of things. First, ours is to see how capacity can be enhanced in the industry, and I think the key areas the association and its corporate members has really played a role in the industry is to ensure that where there are capacity gaps, either with any of the regulatory agencies, we leverage the global best practices available within our corporate members to make those available to the society. So we try to bridge the gap to enable the agencies in Nigeria leapfrog and be able to operate at what obtains in more developed economy. That's one of the things we've done. We've had capacity building with NAFDAC, with the judiciary, with customs, and the rest. For us again, we believe there are technologies available outside of this market that we can make available locally, because it's not in every situation that you can possibly localize the technology you have. So we have our member companies that are working with indigenous companies towards technology transfer. As a matter of fact, we have some of our members that have done compulsory licensure of their products to local companies just to improve access. Again, in NIROFARM, we believe that a lot of people who need medicines produced by our members must be able to have access to those medicines. So we have real land-breaking innovations in terms of how access can be enhanced in this space. And we have our member companies with very innovative packages on how to make life-saving medicines available to patients who need them wherever they need them. Fourthly, we in NIROFARM, we believe in collaboration, and we've partner with the other trade associations. We've partnered with government, Federal Ministry of Health, Federal Ministry of Finance on very topical issues to ensure that the decision taken at the end of the day is in the better interest of Nigerians, better interest of the patients which we serve in our industry. My expectation in local manufacture is this way. We in Aerofarm believe that there's a need that we begin to build local capability in the manufacture of products. But clearly, for us to achieve this, there needs to be a roadmap. We must ensure that some building blocks are in place so that as we go this route, we're sure we're going to be successful. We believe that there should be a baseline forensic audit of capacity of the currently available local manufacturers. The capacity will be in terms of what they can produce and how much they can produce. When this is established, then we know for sure that some products is a no-brainer. There is no need to actually continue to import that, and we will support government to actually restrict importation of those. We believe there should be a second category where the technology to produce them is not rocket science, and those ones, as a nation, we can determine a time frame during which we can ramp up capacity and be able to meet national demand. So it's a journey. And of course, there are the third and fourth category, which now on a foreseeable future, we may not have capacity to produce. So those ones, we just have to, continue to import those ones. But beyond all this, there has to be a real blueprint to walk this journey. Without a blueprint, people want to make investment. There is always the fear that there is no policy, nothing to back the investment up. So there has to be a blueprint, real policy articulating what we want to do, providing the enabling environment, providing the right incentives. Then I'm sure the mantra of self-sufficiency in medicine is achievable in a foreseeable future.
The Olisat net, long-lasting insecticidal nets, and indoor spraying with insecticides caused new malaria cases to fall by 21% and malaria death rates by 29% between 2010 and 2015, while death rates have fallen by a very impressive 48% overall since 2000. Crucially, over half, that is 53% of the at-risk population in sub-Saharan Africa, slept under an insecticide-treated net in 2015 compared to just 30% in 2010 and as few as 2% at the turn of the millennium. Nearly 300 million Olisat nets have been delivered worldwide since production started in 2002, reaching over 80 countries. The impact of prevention has been staggering, with estimates it has single-handedly saved 560,000 lives around the globe.
The first Pharmaceuticals, for us, we're looking at how to bridge the gap between what obtains in developed countries and in developing countries. For us, we're looking at innovative approaches to ensure that products that can be manufactured locally, we speed up, manufacture them locally, and make them available to those people who really need them. The second one is to ensure that we have innovative means to distribute our products, so that the products are available wherever and whenever people need them. Cost to serve in a difficult environment, very rural areas, is a big problem. And for us, we're designing approaches to enable people access our products in distribution and in payments. The whole lot going on our access program to ensure that this is delivered. The third element is to contribute towards developing the right talent for this environment. Myself and the directors and people who support this Lefas Pharmaceuticals, we're looking at how we begin to develop people, mentor people, put the right development programs in place, and ensure that we actually develop a lot of talent, not only for Lefas Pharmaceuticals, but for the other companies in the industry. We believe that wealth of experience that we need to transfer to the young ones coming up. So it's a payback, and we believe it's something we need to do. The pharmaceutical sector is contributing growth. As they say, a wealthy nation is a healthy nation. Health is wealth, and what have you. So the pharmaceutical sector is contributing towards a healthy nation and contributing to the wealth of the nation. But that said, if you look at it in real terms, and the real terms is what's the percentage of the pharmaceutical sector to the gross domestic product, I think it's less than 1%. It still shows that the sector is not, all the resources are not fully, tapped. It's under optimized, so to put it, and a lot of factors are contributing to that. People pay out of pocket for medicine. So when people pay out of pocket for medicines, it limits ability to buy the right medicine, to seek healthcare. And until when we get to a situation where there are mechanisms in place to make sure that the risk for everybody is pulled together, and between the heavy users and the low users, anytime you require healthcare or you require to buy a medicine, you require to be dispensed a medicine, you can get it. Pharmacist Lekon Asuni, as they put it, from Ilaro in Ogun State. I am a pharmacist. Apart from being a pharmacist, I equally hold MBA, and I have about 25-26 years experience in the industry. I worked extensively in the pharma industry, starting off as not like a management trainee, and I progressed, in the company through different roles and different capacities, both in the country and outside the country, to develop myself with the opportunities provided by my company there, GlaxoSmithKline, until 2008 when I became the managing director for Nigeria and West Africa. And within that space, we were able to develop the business, develop the talents, and see that the company is in good shape. Beyond that, I'm a lover of giving back. I'm a lover of volunteerism, so I take part in several volunteer activities and industry activities. I'm currently the president of NairoFarm, Association of Representatives of Overseas Pharmaceutical Manufacturers. I am a fellow of several bodies, pharma and non-pharma. I am the chairman of Development Council of my town, Ilaro Development Council, and so that's me. I try to, anywhere I find myself, I try to play my little role and all. I like unwinding, little time to unwind though, but when I have the time to unwind, I like being with my family. So the little time they have, let me spend with them, give them the little time. I love listening to music. I love reading novels, those that can add to my knowledge and all that. So, and as you know, it's cultural here. We like partying. So yeah. So I'm happily married with kids. So that's Pharmacist Lekon Asuni.
Pharmaceutical industry in Nigeria, like every other industry, has been facing a lot of challenges.
Today, dollar is about 325. So by the time you pay me that money back, the value of that money has gone down by about 20%.
In a few years, I am very optimistic. With this government, things will change.
And that's about it on this week's package of the VTN Business Delite. Trust you enjoyed it. Please do join us next week for another industry player. And please do not forget to subscribe to our YouTube channel. I still remain your host, Priska Chemeka. See you next week.